Do you want to know how to get rid of that limp or how to walk normally again after your knee replacement? Well, this is the video for you. Watch to the end and you'll know the series of exercises that I recommend to my patients, and it has helped them get rid of that limp after their knee replacement. Hi, this is Reggie from Restore Plus Physical Therapy. Almost all my patients, when I ask them, patients who had no knee replacement, when I ask them what are their goals, one of their goals is they want to be able to walk normally again. They want to get rid of that limp. And in this video, I want to share with you what are the sequence of exercises that has helped them get to that level. Because it's just not that easy that after your knee replacement, automatically you'll be able to walk normally again. It's just not that. It's easier said than done, and it's not that. It doesn't go that way. Okay, you have to put in the work and you have to do the right sets of exercises, because if not, you can easily get frustrated that you're not progressing, or you can easily get stuck in a certain stage. So what are these exercises? Let's get down right into it. Oh, and before I forget, I want you to do these exercises in sequence. Now, depending on your condition, depending on your stage of recovery, you may be further along or you may be at the beginning. But I want you to start at the beginning, and if it's easy for you, then you progress. So we'll start off with easy, going all the way to the more advanced. Right, now I move a little further out so you can see my whole body, so that you'll be able to follow these exercises. I hope you're still able to hear me. I'm speaking louder. If not, then do let me know in the comments so that I'll be able to help you out. I'll be able to redo the video or something. All right, the first exercise that I want you to do is, this is especially when you just got out of a knee replacement, you're just recovering, you just had your knee replacement, and you're not really, your balance is not very good. I want you to do this. I want you to start with basic weight shifting. Let's say, for example, my left leg is the one that had the surgery. So I want you to start getting used to putting weight on that leg. Because at the beginning, what will happen is you're not going to put weight on that because of pain, because of fear. I want you to get used to that. So I want you to start putting weight there. All right? So that's what we call weight shifting. And then after that, when you're able to put weight there, you get more used to it and you're more confident. I want you to get to the level that you're actually lifting 1 foot off the ground. So when you do that, this you can do multiple times in a day. The more you do this, the more comfortable you'll feel, the faster you progress. I recommend doing them 3 times a day. You can do 20, 30 repetitions each time. So when you're able to lift the foot off the ground, I want you to get to the 1 leg standing. Now this one, I recommend holding on to a kitchen counter, or for any of the exercises. If you don't feel secure, hold on to the back of the chair, your table, kitchen counter, make sure it's stable. Hold on to something stable, okay? So now, I want you to start doing 1 leg standing. Start balancing. Your aim is to get to around 10 seconds, 12 seconds. That's a good length of time that you'll be able to be confident on putting weight on that leg. When you get to that stage that you're confident and you're able to stand on 1 leg for 10 to 12 seconds, I recommend progressing to the next step, the next stage. And that is, I want you to do exaggerated marching. Now this one, you have to, depending on how much your knee is bending, you have to be able to get at least 90 degrees for you to be able to do this movement there, right? If you don't have 90 degrees of bending, try to achieve that. You can still do this exercise, but I highly recommend getting to at least that 90 degrees of bending. So I want you to do exaggerated marching. Bring your knee up. Right? So now, I want you to make sure you spend equal amount of time on your left and on your right side. Because what happens is, because you're afraid to put the weight on this leg, or maybe because of pain, what will happen is when you lift your right foot, you're going to put it down fast. And when then the left, oh, I can actually balance. And the right, you're going to put it down fast. Want you to have equal length of time left and the right when you're lifting them up. All right, so equal amount of time standing in the right leg, equal amount of time standing on the left leg. So that's what we call exaggerated marching. When you master that already, then you progress to the next step, which is the more advanced one. This one, you will be stepping over an obstacle. You'll be stepping over cones. And I hope you can still see me. I hope you can still see me and hear me. So I hope you can still hear me. So this is the step over cones. I want you to have your feet just in front of those cones. I want you to lift your foot up and down. I hope you can still hear me. So this is the step over cones. I want you to place your feet behind those cones, and then I want you to go step over those cones. So similar to your exaggerated marching, but this time you have to step over something. You have to step over an obstacle. So up and down. And when you're putting your foot down, I want you to be landing with the heel first. All right? So I want you to do, that's what we call step over cones. When you master all those exercises, you will be able to start walking normally. You'll be able to start getting rid of that limp. Now, if you are using an assistive device, you're using a walker, you're using a cane, you can do those exercises also using your assistive device. It's the same sequence, same procedure that follows. Just follow those sequence of exercises using your assistive device. All right? Let me know if you have any questions. Put them in the comments below. We answer all these questions as much as we can. Most of the time, we're able to get through all those questions. Oh, I would love to hear if you have any questions, any comments. Would these exercises be beneficial for you? Is this something that you will be able to do? Do you want to get rid of that limp bad enough that you are going to try these exercises? I would love to know that. And thank you very much for your time. Thank you very much for watching this video. If you know anyone who wants to get rid of their limp and who wants to be able to walk normally again, be it after knee replacement or for any kind of surgery, please share this with them so that they will know what to do to be able to walk normally again. Again, thank you very much for your time, guys. And don't forget, click on that subscribe button and turn on your notification so that you can get alerted when we release our new videos every week. Thank you and appreciate you.